Good morning, everyone. I hope you're well and keeping safe. Thank you so much for joining the webinar today, where we'll be talking about the work we're doing around providing virtual interview services for the police using Microsoft Office 365, Teams and Skype for Business. My name's Tom Scott. I'll be presenting the webinar today. I'm the product manager for ONECONSULTATION. We'll be getting started very shortly. So I'll just give a couple of seconds more to see if we get any latecomers, anyone with overrunning meetings coming in, and then we'll then get started. Right. Okay, we're hovering at the attendees level there, so I'll press on, and the recording will be shared, and the slides will be available for any latecomers. So I won't penalise anyone for being on time any further. So just a quick overview of the agenda for today. I'm just going to talk a bit about the start of just a quick summary and overview of the challenges we've seen that all organisations are facing today with regards to the current situation with the lockdown restrictions imposed because of the COVID-19 disease, and then focus on what the work that Modality is doing in addressing these challenges with our customers, with a focus on the work we've done in the police sector and within the NHS, where we've done a lot of work recently. I would present a case study of the work we've done with Humberside Police and how they are using ONECONSULTATION at the moment, and a look forward in terms of what's next and for our roadmap as well. So we're constantly looking for features and use cases and things that we can build in to deliver to deliver and enhance the product, and finally a summary around some of the positives that we've seen with regards to the technology and some of the bits that it's been that we've seen delivered through these difficult times. A bit of housekeeping before we start. I will pause and for any questions at points through the presentation. There is a chat functionality in the webinar bar on the right hand side. So if you have a question, please put it in there. There'll be time for questions as well at the end. I'll do my best to answer them and talk through them, but if things need a bit more of an in-depth discussion, or I don't know the answer, then I'll take it offline and then come back to you with the details, via the details that you've registered for the webinar with. And I should say as well, if there's anything anyone wants to cover, or if anyone has any specific questions or specific points they'd like to talk about, then drop them into the chat. I'll do my best to cover them in the half an hour that we're working through and address them at the end. So in the work we've done, I mean, Modality have been working as along with Microsoft in the unified communication space for over 12 years now. And the challenges that we're seeing are very much consistent across all organisations using that deliver public services, and it really is how to continue to deliver these virtually whilst the social distancing measures are being enforced. Now the idea of video conferencing and the technology has been around for nearly over 20 years, from the big boardroom type models right through to FaceTime and Zoom and WhatsApp calls that are going on at the moment with people. But the main challenge and that we've seen with people is because of the speed of which the lockdown restrictions were enforced, and due to the widespread nature of it, the blanket lockdown that we've seen across the UK and globally, is the need to offer a digital option for people for the existing services that's quick to implement, easy to use, and crucially is secure as well. And that really across all sectors, all services that use ONECONSULTATION is probably the consistent theme that we've seen. So people need something that is very easy for the public to join. So there can't be any restrictions in terms of plugins or an app to install or to have to create an account to access the service. It needs to be something that's quick and simple to use in order for the public to adopt it and for them to feel comfortable in the technology and see the value in it. I think it's fair to say across all technology, if you put barriers in front of people, making them difficult to use, and lengthy training documents and videos before joining something, people are going to be put off and struggle to join and struggle to use it. So the key thing to ensure success for this is to make it easy for the public to join, as well as the police officer in this case using the technology. And the challenge, the two challenges that we see particularly across the public services and that we've seen within the NHS, and the same challenges within the police force, is that whatever service we do needs to be able to scale and support large call volumes. The services that we're working with across deliver hundreds and thousands of face-to-face consultations and face-to-face meetings every day, and whatever we implement has to be able to scale to support those. Because again, going back to the user experience, if the first time or if someone tries to use this service and they run into the traditional IT barriers of poor call quality and things like that, then again, if the video is freezing or they can't use it, they're not going to use it. They're going to revert to other ways of doing it. So another challenge that we work towards is that it needs to be able to scale and support the large call volumes dictated by the services that you deliver. And finally, the crucial one, and I think this has been very much highlighted in the press, is that this needs to be secure. Now, there's a lots of consumer apps and non-enterprise technologies that do this. So things like WhatsApp and FaceTime can be used, but they are not encrypted, they are not secure, they need someone's personal account to do it. With this, one of the main, because of some of the sensitive nature of some of the services that need to offer this, or the general public to professional interaction, you don't want to be sharing out any of the police officer or the professional person's contact information with the public. So when we build this, there are many, and as well that consultation needs to be secure. So these are our sort of four pillars, that we work towards with ONECONSULTATION, that we've seen these challenges existing out there today when looking at technologies to deliver a digital option for these services. So ONECONSULTATION, as a bit of background, was something we originally worked on with various an NHS trust about 3 years ago, and when we were exploring the concept of using Office 365 and Skype for Business at the time to deliver virtual consultations. And these were our original challenges that have been set out for the service. So these translate very nicely into a lot of workflows and a lot of organizations, because they're universal in terms of, we want to use existing platforms. So if you've got Teams or Skype for Business, then we've built this to fit around the Microsoft Office 365 ecosystem. It's fully hosted in Microsoft Azure, in Modality's Microsoft Azure tenant, and you will connect to it using your Skype for Business or Teams infrastructure, and you use your Active Directory in Azure to authenticate everything. And we give you a dashboard in Power BI that will report on everything for you. So Modality is a Microsoft Gold partner, a Gold 365 partner, sorry. We very much look to extend that existing Microsoft environment to deliver these services. And as a summary of what it delivers, we look to leverage Skype for Business and Teams where possible. So the idea of that is that you have Skype for Business already and Teams already embedded in your organization. People know how to use it. There's no need to train them on it. They can continue to use that. What we're giving is the ability for them to use it to deliver these virtual consultations. The Azure platform gives us the ability to build a highly scalable, secure service, and we can provide a simple, customized portal for both the member of the public coming into the call and also the officer using the administration screen. We can give. There's no need to download any software. We can give multiple waiting rooms for different services or for different interview rooms, depending on location, the service using it, the type of interview room that you want to give. We can give multiple ones of those, and we can also restrict access to those to specific police officers. It's delivered as a software as a service model, so it's all hosted by Modality. There's no additional infrastructure required from your side. It's all hosted and managed by us. And crucially, from the security side, we do not store any personally identifiable information for any of the members of the public that are joining the meeting. So I will just move into a quick demo now to show you what an example of the administration portal that the police officers would use, and an example of the member of the public website that you would be able to send out so that they could join the consultation. I'm just going to check in the chat to see if there are any questions come in before starting the demo. Nope, nothing as of yet. So this is, I will just bring up onto screen now. This is the, beg your pardon, an example of the member of the public website that they would give. So this is the one that we've built and that Humberside Police are currently using today. So what would happen from the booking side is that they are using this, and I'll come on to their case study in a minute, but they're using this to send out virtual, to schedule virtual interviews with people. And we've created a digital interview room for them. We've created 5 digital interview rooms for them. They will send this website, which relates, they've got 5 of these, interview video room 1 through to 5, and they will send this to the member of the public when booking their appointment, either by email, text, or letter, however they want to communicate it. This link will always be the same for anyone who's got an appointment in this video meeting room. When the member of the public comes into the room, they would enter their name and their incident reference number if they know it. These questions are fully customizable, so there's no authentication done by these. This is purely so that the police officer can identify the correct person or the consultation to go into when they've joined. So once you've entered those details, then it's as simple as just click on Begin Consultation. If you click on Test Call, that will allow you to validate that your speakers, microphone, and webcam are all working. But just click on Begin Consultation. Then there's a picture of me working from home. Then you will get you'll appear in this lobby, and then from the member of the public side, that's everything that's been set up. So it's as simple as that for them to come into it. All the technology is within their web browser, and that's on their smartphone, tablet, PC, whatever they're using. For the police officer that will be using ONECONSULTATION, they will log into admin.oneconsultation.net, and they'll click sign in, and we authenticate this with your Office 365 environment. So they would use their Microsoft credentials to log into this. There's no additional password needed. They choose which room they'd like to enter. So again, you can restrict access to those rooms to specific officers. And then what the police officer will see is that when someone comes into the call for their consultation, then they will appear in here. So these are the identifying questions that I've just entered, so that I can see that for this appointment, Tom's arrived, this is the appointment number, and you then have, this is like a virtual waiting room screen that they're in. And then from the police officer side, they will click on enter room. This will open Microsoft Teams or Skype for Business, and they will then go into the call. So the idea is that the police officer will join for using Microsoft Skype for Business or Teams, and the member of the public will join using their web browser. When they click on enter room, it will go to open Microsoft Teams, and it will open the conversation in Teams. And the police officer will just be able to connect directly to that consultation. The final element, or just the final demo to show you here, is that you have multiple rooms within. You can have access to multiple waiting rooms, so you can change rooms or see the consultation waiting in different rooms. And you can also move these consultations between rooms as well. So if someone comes into the wrong room, there is an administration element that allows you just to flip them between, put them in the right waiting room, and they can still have they can still be in the right place for that consultation. So as a quick demo, I just wanted to talk you through show you the two different user experiences that that people had there. I will just go back to the presentation. So the final two bits for me, and just to talk through the work that we've done with Humberside Police. There we are. We started working with. Oh, sorry, I've just seen one question come in that I'll just address before doing the final two bits. So the question was around how do you prevent officers from booking the same meeting room at the same time for different interviews. So the way that that we've built ONECONSULTATION is that it fits within. It's designed to fit within existing processes that you have. So what Humberside Police have done is have assigned an Outlook calendar to each waiting room. So there is the ability so they can book the sessions in there. They make sure that there's no overlap for them, and they can then go and use the invitations are scheduled using Outlook to avoid that. It is possible to have more than one person in the waiting rooms at any one time. Think of it like a doctor's waiting room, that you would have multiple people waiting and then multiple people being able to access it if you want to manage it that way. But the way that they do the scheduling through for this is using Outlook calendars associated with each of the digital interview rooms. And then in terms of the other question around Office 365 being set up, that we do have an option to trial the service. That means that you can do it without having Office 365 and Azure AD. That's something that we can set up and trial for you, but we would recommend that for any production service that you would use Azure Active Directory and Office 365 to deliver to use that to maintain, so that you don't have that password entry. But we can set up that trial for you and then have those discussions to see if it fits. And there's another question around group consultations, but I'll come on to that at the end when talking through the roadmap. So I think I've spoken about Humberside Police a lot in this. We engaged with them before all of the COVID restrictions were in place. The COVID restrictions really accelerated the work that we did with them. We've implemented 5 virtual interview rooms that are now in production use, and they've used them to deliver over 50 consultations since that went live at the beginning of April. We've also deployed a real-time reporting dashboard that uses Power BI to visualize the call quality and usage information for their consultations. And we're looking to start to trial or start using the service to take statements using a combination of ONECONSULTATION and Adobe DocuSign. And that starts in the next couple of weeks. So what we've seen is that's allowed the police officers to offer the service to a member of the public. They use Skype for Business to join, and then the member of the public can use their web browser to join. And they join anonymously and securely from that side. So in terms of the roadmap for ONECONSULTATION, I won't talk through all of these elements in there because some are specific to healthcare. The high level ones, we had a question on this around multiple people can join the same room. That's the big piece that we are looking to release in the next week or so that we've got in a couple of scenarios today, and we're looking to release into production in the next week, sometime next week. It is possible for people to join, for multiple people to join the meeting from both sides. The workflow that I've shown you is very much designed as a one-to-one police officer to member of the public scenario. It is possible in the current ONECONSULTATION environment for multiple police officers to join the consultation, to join the meeting, but there would only ever be one member of the public. We're launching group consultations next week, and that will enable multiple members of the public to join with a police officer present. So the way that we're working, so that would be good within some service for interpretive services. So if anyone needs a language translator, or you need someone like to do sign language, then that was the initial use case for these waiting rooms for that group consultation. But we've got 2 scenarios: one where you have a third person coming into it as an additional consultant, either if it's a responsible adult for someone, or it's an interpreter, or one of a number of use cases where you could use that technology. And the other scenario is where we're calling it the auditorium setting. And what that means is that there can be one or two presenters from the police side, multiple members of the public joining, but the members of the public can't see each other. So it's all anonymous from their side. So they only see the presenter, and they, so that's designed for group sessions or training courses or things like that. So the key thing from our point of view is flexibility. We're trying to deliver. There's no one size fits all for those different scenarios, but what we're trying to cover is a wide variety of use cases using the different setups within one consultation. We're also looking at bringing in open and close hours, ability to broadcast text to the waiting room, and then we're also looking at bringing content sharing into this. So the ability to support a consultation by sharing a document or sharing a visual aid when talking to people. So just in summary, as I said, we've done a lot of work with the NHS and with Humberside Police, and the response we've seen from all IT teams under pressure to enable people to work remotely has been incredible. There's a lot of recognition for staff on the front line, but which is rightly so, but also in the background for people enabling services to continue as usual, the response has been incredible. It's highlighted very much that providing that digital option for people is crucial. So when the dust settles and people go back to whatever kind of normal we have after this digital option is something now that people are going to need to maintain. And just a final thought from us, if you're looking at using Microsoft Office 365 and Teams and Azure, then ONECONSULTATION has very much been built to fit into that ecosystem. We're not interested in taking things off to a different platform. We want to drive and keep everything within Office 365. There's a free trial of ONECONSULTATION available for a month. The details are in the website below, in there to be able to go and sign up for that and register for that. And we'd be happy to work with you to see if we can help you get something created and up and running. So that was everything I was going to talk through today. Just pause for, there's just been a couple more questions come in. With regards to multiple people can join the same room, then I think we covered that on the group session sides. There's so many different types of scenario that we can enable with that. That's really something we can give a platform to be able to do it, and then ultimately leave you guys to design or to build the workflow that you'd like to go into that. And the final question that's come in has been around, is an interview recorded for later viewing if required? We have a recording functionality in preview at the moment. It is something that we're looking at within ONECONSULTATION. It will be stored, the session will be recorded, and the recording would be stored in your Azure tenant, is the model that we're working on. It's something that's in preview at the moment. We are exploring this with various customers to see how it would work in practice. So it's something that's there. We can have a conversation about it, definitely, if it is a requirement within ONECONSULTATION to move forward with it. And just time for one final question, I think, looking at the time. A question of how is ONECONSULTATION licensed? Is it per room or per user? So ONECONSULTATION is licensed on the number of concurrent sessions that you have. There's no limit to the number of services or users or devices that can access this. It's purely on the number of concurrent meetings that you have. So when we talk about consultations, we assume a consultation is one police officer and one member of the public. So you can have as many services as you like. The only limitation would be if you bought 10 concurrent connections, that would allow you to have 10 simultaneous meetings at any one time, but there's no usage to the actual number of sessions that you can have. And that license would cover provisioning, service, maintenance, new features, support, everything from that. It's a fixed cost for that. So there's no user charges or charges per service room in that. It's all on concurrency. I'm 1 minute over, so I will not take up any more of your time. Thank you so much for your time joining today. I hope this was useful, and I'll just say stay safe and have a great rest of the day. Thank you, everybody.